In this video we will be discussing the types of consent every EMS provider needs to know. From implied consent to the intricacies of caring for an unsupervised minor, we will demystify it all for you. Welcome back to our EMS Incident Command channel. We are delighted to have the opportunity to discuss relevant EMS topics with fellow EMS professionals week after week. Please let us know in the comments how we are doing and if there is a topic you'd like us to tackle. All our videos are fact-checked by industry leaders and made by experienced paramedic leaders working in the field. Let's get started. A large number of EMS responses are requested by the patients themselves. These types of emergencies are the easiest to navigate consent for. An example of this could be someone experiencing chest pain and requesting your emergency medical services. Whereas, things can get complicated when there is a third-party caller requesting EMS services for something they perceive to be an emergency someone else might be experiencing. These can be especially tricky to navigate when there are suicidal ideation statements made by someone other than the patient. If the patient themselves are denying making such statements and are refusing EMS evaluation, treatment and transport, consent can become a challenge. In these instances you need to refer to your EMS region protocols, use your best judgment, involve law enforcement, if necessary, and always consult with online medical control. For more information on this, please see the link at the end of this video to watch our ultimate guide to documenting EMS refusals, and our mental health crisis, paramedics' role in intervention videos for more information on this topic. Now, let's tackle the different types of consent you might come across in your line of work. We promise to keep it simple. Informed consent. This is the gold standard. You give the patient all the information they need, your paramedic impression, treatment options, risks, benefits, and what happens if they consent or not. They must be able to make a decision and fully understand everything before giving their consent. Expressed consent. Similar to informed consent, clear and to the point. This is when the patient says yes either verbally or in writing after understanding the treatment. It is the action of consenting. Implied consent. In emergencies, when the patient cannot verbally consent, you assume a reasonable person under similar circumstances would consent to treatment if they could. This is the go-to in urgent situations. An example of this could be a diabetic patient experiencing a hypoglycemic event with an initial altered mental status, or a person who fell 4 stories and is now unconscious and has serious injuries. Implied consent gives you the avenue to treat and transport this type of patient whenever is medically necessary. Parental or guardian consent. Minors need their parents' or legal guardian's approval for treatment, usually. But there are exceptions for situations where threat to life or limb exists. An example of this could be a minor experiencing an asthma attack or involved in a car accident with serious injuries present. If the legal guardian is present, that's easy, they get to make that decision at the scene. But what if you have a minor with no injuries from that same car accident? Do they have to go to the hospital? Not necessarily. There are a number of things you can do in a situation like this, where no threat to life or limb exists. You should always follow your EMS region protocols and always contact online medical control for guidance. However, prior to calling medical control, and after completing a full patient assessment, you could attempt to contact the legal guardian on the phone and give them all the information they would need to make an informed consent decision. That is, your paramedic impression, treatment options, risk, benefits, and what happens if they consent to EMS treatment and transport, and next steps if they don't. If it's feasible, you can arrange for the legal guardian to come to the scene and take charge of the minor in situations where they prefer not to have the minor transported to the emergency room and there's no immediate life-threatening situation. Alternatively, if urgent treatment is needed, and time is critical, it's advisable to direct the legal guardian to go directly to the emergency room after giving them all the information one would require for informed consent. What should you do when there isn't a legal guardian around, and you can't reach one? In such cases, you can consider the concept of implied consent. If after assessing the situation, you conclude that it is in the minor's best interest to receive vital medical care and you've consulted with an online medical authority, you may request the help of law enforcement to ensure that the minor is placed under protective custody, ensuring they receive the necessary health care. Advance Directive, POST and DNRs. Some patients may provide written instructions in advance regarding their healthcare preferences in case they become unable to make decisions in the future. These documents guide healthcare providers when the patient is unable to make decisions over their own healthcare. EMS personnel are generally obligated to respect the treatment preferences and limitations outlined in valid advance directives, physician orders for life-sustaining treatment, or POLST, and do not resuscitate orders, or DNRs, as long as these documents are present at the scene, in the state-approved form, valid, properly executed, witnessed, appropriately signed, and comply with local state law. Specifics can vary significantly by state, so make sure to follow your EMS region and local state laws on this matter. The document needs to be up to date and reflect the patient's current wishes. The patient has the right to change their mind at any point, provided they are capable of decision-making at the time. It is advisable to consult with your EMS region, legal counsel, or healthcare professionals knowledgeable about state-specific regulations related to these types of orders. If there is ever a question, the lawyers and their kin will look over the documentation. We always have to be able to justify our actions through documentation. Navigating the complexities of consent is an essential aspect of providing high-quality care, and understanding the various types of consent can make a significant difference in emergency situations. We hope this discussion on consent in EMS has been valuable to you. Please like and subscribe. It helps us grow and it is the best way to support our channel. We are committed to providing you with relevant and useful information. Let us know in the comments what you would like to see more of. Please be safe out there and we'll see you in the next video.